Monday, December 27th, 2021, just 2 days after Christmas, Dr. Leiser dies by suicide. He had become one of 400 doctors lost to suicide in any given year based on pre-COVID data. Why did that happen? We don't know what the circumstances of the situation were, but let's look at what we know. He was 50 years old, had been a physician for 20 years, married with children, worked at the health system in Minnesota. I wonder if I know anybody who can relate. I'm 50 years old, been a dentist for 20 years, work at a health system in Minnesota, married, children. No, that doesn't give me any insights into his particular circumstance. I just wanted to use myself as a stand-in case study. By the end of 2019, I had been out of training for 17 years, very much enjoying my job. Other than the occasional stressful day at work, I would say I had a fairly balanced life. Then 2020 rolls in. In March of 2020, the state of Minnesota reports its first case of COVID-19 pneumonia. We were dealing with an unknown infectious disease, a lot of uncertainty, no viable treatment options, no vaccines. We tried to flatten the curve, but that didn't work too well, unfortunately. By the end of 2020, 2 vaccine options become available and are rolled out to frontline healthcare workers. I got my 2 doses and I was fairly optimistic. As the vaccine is rolled out further, some not so insignificant portions of the general population, including my own community, become more vocal about their opposition to the vaccines. The relationship between healthcare workers and some of their patients becomes exceedingly antagonistic, oftentimes resulting in long, drawn-out arguments about American doctors and the big lie. But back to our 400 doctors. I wonder whether this is truly what I signed up for. Is this something that we should just accept? Who's next? In March of 2022, President Biden signed the Dr. Lorna Breen bill in honor of Dr. Breen, a New York emergency physician that was lost to suicide after battling the first surge of COVID-19 in New York. The bill aims to further investments into mental well-being of healthcare workers. And specifically, the Department of Health and Human Services must award grants to health systems to promote mental well-being in healthcare workers. But how big is the problem exactly now that the pandemic no longer dominates our lives? We set out to quantify the current state of mental well-being of healthcare workers and determine what measures employers can take to effectively improve mental well-being. We distributed an electronic survey to medical and dental frontline workers at 2 health systems in Minnesota. And the survey contained 3 validated tools to assess various aspects of mental well-being, including depression, stress, and mental health. We got a number of responses from both medical and dental frontline healthcare workers. 2/3 of them were doctors, meaning physicians or dentists. The rest was medical and dental staff. And about 96% of those respondents had worked into direct patient contact during the COVID-19 pandemic. The resulting depression scores shows that all groups suffered from moderate to moderately severe depression, and there were no differences among groups. And for all groups, active treatment is recommended. More than 10% of individuals in each group suffered from severe depression. These individuals need to be our primary focus because they may be at risk of suicide. The stress scores show that all groups had much higher than average stress, and the associated health concern levels are very high. The distribution shows us that the vast majority of individuals fell into this group. The mental health status of all groups was fair, with an average score of below 40. For comparison, the average score of the US population is 50, indicating good mental health. Our providers scored a full standard deviation lower. Disturbingly, more than half of the physicians and more than a third of the dentists were in poor mental health. That's significant. Nobody wants to be treated by a doctor in poor mental health. Now, we were fortunate enough to get our hands on data from people who attended the Minnesota State Fair, essentially at the same time that we distributed the survey to all providers, and we used the same survey tools. The resultant comparison data shows the problem even more drastically. Less than 2% of State Fair attendees were in poor mental health, but that was the case 20 times more often in our healthcare workers. It appears that a major part is the current climate in the healthcare industry, rather than the profession itself. More than half of the respondents were satisfied with their career choice, but only few were satisfied with the current climate in the healthcare industry. Now, what is it that the healthcare systems can do to help with this problem? Our results suggest that adjusted work hours, rewards and incentives, and teamwork are the best strategies. These were identified as the most effective by the intended recipients. That's also exemplified by some of the comments that we got. For instance, job creep has to stop. More people need to be hired rather than dump responsibilities onto the remaining staff and then burn them out. Or, we are overworked and we need peer and staff support for a balanced workload. But unfortunately, that's not what healthcare workers get. So in summary, the mental well-being of healthcare workers is poor. Many consider leaving the industry with stress and burnout being the main reasons. Healthcare leaders must understand the gravity of the situation and take action. Prevention of loss of mental well-being must become a priority. This study may provide the tools to do so. Thank you very much.